Well, I think this ESMO 2024 in Barcelona has been quite impressive for bladder cancer, and we've heard very interesting data that actually, some of them will have to be transferred to our clinics soon, hopefully. Let me just start from less to more. So 3 studies that I think are relevant in the context of muscle-invasive bladder cancer. The first one is the study called SunRISe-4. SunRISe-4 is a program where patients with muscle-invasive bladder cancer that are not fit to receive cisplatin-based neoadjuvant chemotherapy or not willing to do so receive an intravesical device called TAR-200 that releases gemcitabine, and Cetrelimab, which is an anti-PD-1 that acts systemically. That's one of the arms. The other arm is only Cetrelimab. The endpoint of the study is pathological complete response rate. And we've heard some preliminary data presented at these ESMO 2024, and I think the numbers are quite impressive. PCR of 42% for the combination versus 23% for single agent. And actually, when you look at clinical stage T2, those numbers go up to even 48% of pathological complete response. So even if these are small numbers, I think it opens a new area about approaching muscle-invasive bladder cancer in the context of the perioperative treatment. So that was one study. SunRISe-4 testing a new approach, TAR-200 plus Cetrelimab versus Cetrelimab in the neoadjuvant context. Okay, let's go to another study in the muscle-invasive bladder cancer context that I think it was relevant, is the TOMBOLA study. So TOMBOLA is actually an academic study from Denmark that actually is trying to refine which patients should receive treatment in the perioperative setting. And what they did is very simple, but at the same time very interesting. They treated patients with muscle-invasive bladder cancer with chemotherapy, cisplatin-based chemotherapy, and after cystectomy, what they did, it was looking at ctDNA. And the objective of the study was the percentage of patients that would achieve a complete response after surgery, and complete response was determined by ctDNA negative and no disease on a CT scan. The study, although again is still preliminary and small numbers, what it tells us is that ctDNA is a very good predictor of recurrence, and probably this data that will grow in time, what they're going to do is help us in selecting which patients should actually receive the adjuvant component in the perioperative treatment in patients with muscle-invasive bladder cancer. So those are the 2 studies that somehow are interesting. One looking at a different way of treating muscle-invasive bladder cancer with intravesical devices plus checkpoint inhibitor. The other one looking at refining patients who need adjuvant component. But the biggest study that has been presented at this ESMO is the NIAGARA study. So the NIAGARA study is basically a trial, very large trial, with over 1,000 patients with muscle-invasive bladder cancer who were randomized to either the conventional treatment until today, which is cisplatin-gemcitabine 4 cycles followed by cystectomy, compared with cisplatin-gemcitabine plus the checkpoint inhibitor Durvalumab for 4 cycles, cystectomy, and then all patients would receive 8 cycles of monthly Durvalumab. This is an enormous trial, is a large effort. We've been waiting for the results for a long period of time. This study was looking at event-free survival as the primary endpoint. They were also looking at pathological complete response as a valid endpoint at the same time. What have we seen? It is a positive study. It was positive for events-free survival. And what we've seen is that the study has an impact in progression-free survival with a hazard ratio of 0.68, and is also positive for overall survival. And this is the remarkable thing, with a hazard ratio of 0.75. It is true that there are still some unanswered questions in this study. It is true that this is still preliminary data, and we're trying to ask some questions like, what happened when these patients progressed? What was the subsequent lines of therapy? How many patients actually received treatment on each arm? And some other questions like chronic toxicities related to the treatment. But even considering all that, I think this study is going to be most likely practice changing. I think this is probably the biggest news from ESMO 2024 in bladder cancer is we may be confronting a new standard of care in muscle-invasive bladder cancer.